Hi kids, I want to help you out with your poster and give you a little bit more inspiration by showing you some examples here. First, I want to show you this one. This is the simplest form of a poster that experimenters get to use. Now, you guys are not experimenters, you are called reviewers at this point because you're using a systematic review to put a bunch of case studies together and give us some summary on it. But some of these might actually apply to you more than you think. Let's start with the introduction over here. This is a summary of what is going on in current research, as in your literature review would be excellent to summarize right here, and you can certainly put pictures in there as well with the figure captions right underneath of it. Then when we look at the materials and methods section, you might ask yourself, well, I didn't really have any methods. I just looked for um, a bunch of case studies. And I would argue that is a methodology. You use particular criteria to look for case studies and try to figure out exactly what are the similarities between them. So that is a methodology. You can describe how you went about finding these particular um, case studies and organizing them in the way that you did. The results section is maybe what I would call the outcomes for you, as in these are things that you have figured out based on the information that you have. It's a really good idea to have some sort of flow chart or figure, some graphical representation of your data or of your outcomes and results that you found through all these case studies so that you can show it in a way that doesn't just look like word vomit on a poster. Instead, gives your ideas some life. Finally, the discussion section is where you kind of cap it all off and tell me exactly what does this mean for the future? What can be done in the future? What needs to be done in the future? A lot of that will be applicable to you guys because that is something that you want to have. You want all this research that you did to mean something. So you should come up with some idea of how this can be used in the future. The references are only the ones that you use on the poster. Do not put every single reference you've ever used because you're not going to have enough room for that. In fact, this is supposed to be smaller text, but you guys have so many case studies that it might not even be efficient for you to have a true full references section. So if you used your case study as a piece of your materials, as in it's just something that you looked at, instead of looking at introduction stuff like the background of your condition, like spastic muscle conditions or pneumothorax or Botox in general, I would cite those things in introduction and maybe not as much as the case studies that you're using as data points. The acknowledgement section is optional. It is something that you can do to thank individuals who have helped you through the process, who have supported you during this time, including your parents. Typically, it's used for thanking individuals who provide you with funding. You don't have to do that. You're just thanking me if you're doing that. You're certainly welcome to thank me, but you have more of yourself to thank, that's for sure. That brings me back to this part right here. This is the abstract, and this is a summary of all the different parts of your poster so that if you're talking to someone and someone else comes up to read your poster, they can look directly at this section and get a good idea of your entire poster without having to sit there and read every single thing, waiting for you to finish up your conversation with the other person. The abstract is typically constructed of a couple of things. It's basically 8 sentences max. I would maybe even say 6 sentences, especially for your guys' case. It's a summary in 2 sentences of the introduction, summary in 2 sentences of the materials or methods section, summary of the results in 2 sentences, summary of the discussion in 2 sentences. And of course, those can be less, especially if you don't have those particular sections. I want to show you some examples that I found that may or may not be applicable to you and may not be even good posters, but some that we can at least discuss together. Here is one dealing with acute pneumomediastatinum, where individuals have a heart condition um, caused by blunt trauma and physical exertion. You can see that they have a background here, and they have a methods and material. If you spend time reading this methods section, it's going to tell you that all they did was they looked at x-rays, particularly this one x-ray of one patient. That's why I think you guys are in such a great position, because other posters use a lot less data than you guys did. You guys have done a marvelous job accumulating data, and you now have an opportunity to really consolidate it and put it together for an audience as big as we have. They do have a figure here. They didn't include any captions for the figures. I would say this would be okay, but not great. But the figure that they show here is a simple flow chart of exactly what they should be doing for this patient based on these things that they found in these x-rays. And you can make the same arguments for your Botox treatments, your spastic muscle disorder treatments, your pneumothorax treatments, anything that you saw that was a pattern of things that happened. You're putting together kind of a visual representation so that people can walk up your poster and say, oh, yes, now I understand what to do for a patient who is involved with a pneumothorax in an infant or something along those lines. They have outcomes listed separately from conclusion. Their outcomes, if I can summarize in a second, are just them talking about the treatments that were most applicable to the patients that they had. And the conclusion is, again, something that they discuss that needs to be done further from this study. Some things I don't like about this are the spacing, the differences in font size, and the references aren't really actually referred to up here at all with parenthetical citations. You guys can certainly do better. This is an undergraduate that did this. Here is another one from a school of nursing at, I think this is at Texas again. Here they have the background, very short and brief, 4 bullet points. I would argue against bullet points because you guys have more to say. They have in this study a purpose, as in what exactly was the reason behind doing this? What is the main goal of this literature review, this systematic review? They have the methods as their literature search. Again, bullet points for this in particular, not great. I don't think I'd spend my time reading these bullet points at all. I would spend time reading your sentences because you're my students, but at least if you have sentences and paragraphs up there, you look really smart. The assessment of the current practice is just their methodology section here, as in this is how they figured out how to sort these particular treatment plans. The results section, again, small, and they have a big figure in the bottom right here as a key for exactly what needs to happen. Please don't use emojis like this to show significant results. That would be a bad idea. Conclusion, very short there. Proposed evidence, very short there. They use emojis, by the way, because it's about sleep disorders. But seriously, you guys are better than that, right? You got this. Here's another one from University of Maryland about genetic markers in cardiovascular disease. In particular, I wanted to show you this one because of the methods section. It has a figure with a beautiful caption right here. It's listed in the proper format with figure 4 period, as in that is exactly what we need to have for listing out figures. And then they have a 1-sentence summary. Don't even have a verb. That's totally fine. That's the way that's written. And then that's in bold while they further summarize it in the rest of the figure caption. Love it. It's actually pretty much perfect. Okay. Again, they have a figure here that shows exactly what their methods were in terms of how they did their research in their different pieces of literature. in a graphical representation. This allows your reader to be able to understand what you did without having to read everything and without it looking stupid with a bunch of bullet points. Let's see. Is there anything that I don't like about this one? I would say the acknowledgments could probably fit somewhere over here, and I would say future work or results should probably be somewhere down here, or maybe swap those two, the future work and acknowledgments. I don't know. You're going to have to work with what you got in terms of spacing for sure. I think they were limited on spacing. I think this is technically a smaller poster than what you'll have. Um, I would say having an abstract this long and in the center and big is maybe not effective, but it is something that you can do if you have a particularly long abstract and don't have room over here because you have a particularly long background for all the stuff that you have done your research on. This last one here is a literature analysis straight up from a graduate student at the School of Nursing in Austin, Texas. And their particular setup is background and purpose, along with the current practice, as in, this is what I noticed from my research that is done currently. And over here in the literature results, they put together things that are new and have been working among select individuals and summarized it as pieces of literature. So this is kind of like a works cited and a literature analysis at the same time. Notice they have a methods section that is separate, of course. They only have 5 studies. You guys beat them left and right. The conclusion does summarize the results pretty clearly, and this figure is okay at showing exactly what they propose for the practice change to be from what is current standard to what is now being tested and treated. This is a pretty good one to look at more closely if you'd like to. I think the pictures in the top left and right are kind of juvenile. I would rather have them as figures down here. But again, spacing was a concern for this group here. Spacing would be a concern for you too. I know that. I wanted to show you one more because this is what I would consider pretty much the gold standard because she did a wonderful job. This is Kristen's from last year. I think she did a marvelous job at setting her poster up. And notice she does not have it in a typical format. She has it as introduction over here, the background information about this disease that she researched, the case studies from all that she could find on those particular research studies. The diagnosis and treatment is split up into um, a what's the word I'm looking for? A figure, a flow chart, if you will, based on the diagnosis that they have and what treatment should be expected for it. They have a common treatment here for these two types of chromhidrosis. So she put these side by side and had them go to one box. And then she had possible new treatments that she found in there, which I think is marvelous job. I wish her figure captions were a little bit longer in terms of description so we knew exactly what we were looking at. But otherwise, the conclusion right there summarizes exactly what she's arguing. The resources are wonderful. She did list every single one of these 16 case studies that she had. Again, I'd argue if you're using them as data points, you might not need to include them in resources. You can always, if someone really asks you, hey, where'd you get all these case studies from? Print out a case study list as a resource page separately from your poster and just have it on hand next to your poster so they can see every single case study you looked up. You can be a smartass about it. It's totally fine. This, I think, is a pretty darn good poster for exactly what you guys are going through right now. You have a disease or a condition that you've been doing a bunch of research in. We have a present presentation or background information that we know about it in normal terms, and you guys have done the abnormal research here, the case studies itself. You just need to put it together in a way that shows what you have learned so that we're not just reading a bunch of word vomit. Hopefully that makes sense. Hopefully I can be of some help for you there. Let me know. I'm here for you.